Hello and welcome to Health and Wellness Save a Life. Now, it's important to live a balanced life, and our health and well-being obviously play an important role in this. Every day we're warned about the many devastating diseases, but perhaps one of the deadliest of them all is heart disease, the number one cause of death in men and women worldwide. More people die from it each year than all forms of cancer combined. And heart disease doesn't only occur in older adults, it's now affecting younger adults more and more. Heart disease can also cause death instantly, and the main reason for heart-related diseases is a lack of awareness of what exactly one needs to do in a cardiac emergency. Now, educating people about the signs of a heart attack and a cardiac arrest and the importance of taking immediate action can help improve survival as well as minimize damage. And we have with us experts to do this, to reduce mortality rate through awareness and bystander intervention and life-saving techniques like cardiopulmonary resuscitation. We're joined today by Dr. Biswaranjan Jena. He's a consultant interventional cardiologist from Cuttack. Dr. Rizwan Deshmukh, who's a consultant interventional cardiologist at the Apple Hospital, Aurangabad, is with us, as is Dr. Vikas Medep, a consultant interventional cardiologist with the BVR Super Speciality Hospital, Secunderabad. Thank you all for joining us. Dr. Jena, let me begin with you. It's become very common, altogether too common, that young, fit people seem to be now succumbing to sudden cardiac death. And of course, there have been so many instances where these have hit headlines with celebrities involved as well. What are the reasons behind these deaths?
Yeah, thank you. Good afternoon all. So that is definitely unfortunate that we hear now that all young population also are dying a sudden cardiac death. So as the term goes, sudden cardiac death means the symptom onset or somebody get ill and within 1 hour he will die, and that is called sudden cardiac death. And previously there will be no much history or there will be no much disease element for that person also. If you take the young people, then what happens? There are three things. The most common cause of sudden cardiac death in young people are 80% of them died of heart attack, or there is a blockage in the artery or coronary artery, and there is a heart attack that will lead to the sudden cardiac death. Except that there are two other things, like somebody have a structural heart disease in the form of cardiomyopathy. That is also a common cause of sudden cardiac death in young. And suppose somebody have some channelopathy, as you tell, that means from congenitally there is some genetic abnormality, there will be some issue in the rhythm or heart rate system of that heart, and that will lead to sudden cardiac death. Basically, sudden cardiac death is due to arrhythmia. Arrhythmia means the heart beat becomes chaotic, the heart cannot pump blood properly at that time, and that leads to death. And the most common cause, as I told, first of all, this is coronary artery disease, means atherosclerosis or blockage in heart artery leading to heart attack. Then other two things are like any form of cardiomyopathy or any form of channelopathy.
Right. Dr. Deshmukh, let me bring you in also. We shouldn't perhaps ignore a pain in the chest, but people often dismiss pain in their legs, as there can be multiple reasons behind leg pain and they're generally related to overwork or to physical stress. But can heart problems also cause pain in legs?
Yes. Good afternoon, everyone. As we have coronary artery disease in which the arteries of the heart are blocked, likewise, the arteries in the leg can also get blocked, and that's what we call as peripheral arterial disease. In peripheral arterial disease, either one limb or both the limbs can have a stenosis or blockage, which causes difficulty in walking, which we usually call it as claudication. So whenever a patient has difficulty in walking, and at sometimes even difficulty, pain at rest also, he or she should consult a cardiologist or any physician to look for the same. Coronary artery disease, the mortality, the patients who have peripheral arterial disease have the same conditions in which the coronary arteries can also be involved. So yes, anyone who's having pain in the legs should consult a cardiologist or a physician. Second thing, sometimes in conditions where a clot in the heart can just suddenly come out and go and land up in the legs, that can also cause an emergency condition, and it should be treated immediately.
Dr. Jena, if we can bring you in, how are preventive heart health checkups important? What are the tests involved, and how often should these be done?
Yeah, this is one of the most important aspect, how to know that who are at risk. Thing is that I previously told that sudden cardiac death, the most common cause, one of the most common cause, 80% of cause is coronary artery disease or blockage in the coronary artery. So usually our evaluation starts from history taking, then comes to physical examination, then comes to tests. So we go for a history taking first. Is there any risk factors, like somebody is smoking, somebody has a drug, means somebody is used to some drugs like cocaine, somebody has a family history of sudden cardiac death, somebody has diabetes, somebody have hypercholesterolemia. So these are the risk factors. First we ask them, then we will go for some form of physical examination, and from that also we get some clue. Coming to tests particularly, then one of the most common tests we advise, that is ECG or electrocardiogram. By that we can know what is the rate of the heart, what is the rhythm of the heart. Then we advise them for echocardiography. Basically that will tell you what is if there is any structural problem in the heart. Then there is a stress test. Basically we advise for TMT. There are different forms of stress test, but usually in health checkup we advise TMT or treadmill test. By that we can know whether somebody is suffering from coronary artery disease, how the heart behaves when there is stress on it. So these are the things, three common things which we advise. Then coming to the sophisticated one, suppose from history or physical examination we think that this person will need this particular test, then test like cardiac catheterization in form of coronary angiography or pressure measurement in the heart. Then sometimes we take biopsy from the heart. Then there is CT heart or CT scan of cardiac structure. Then there is MRI of heart. Then of course there is something called electrophysiology. If you are talking about sudden cardiac death, by electrophysiology test we can induce that form of arrhythmia or induce that form of rhythm problem what is there in the patient, and we can treat that. So these are the few tests which we advise to look for any disease condition.
Let me also take this across to Dr. Medep. We all know feeling constantly stressed could increase your risk of heart and circulatory disease, but can acute stressors also lead to sudden cardiac death?
So acute stress leads to release of certain hormones called as catecholamines. These hormones can cause abnormality in the heart rate and rhythm, as we term it as arrhythmias. So arrhythmias can lead to sudden cardiac death. Also, when there is increase in the heart rate, the heart would need excess amount of blood supply for its optimal functioning. So, and if there is a blockage in the blood supply to the heart, so the heart will not receive enough amount of blood supply, which can precipitate a heart attack. Also, these blocks that are there in the heart or blood vessels of the heart, they can rupture, leading to development of heart attack. So, acute stress, release of catecholamines resulting in arrhythmias and precipitation of heart attack. So, these are the two commonest causes for sudden cardiac death whenever there is acute stress.
Right. Dr. Deshmukh, many people get confused about heart attack, cardiac arrest, heart failure. Could you explain the differences to us?
Yes, ma'am. I'll make it very simple. A heart attack is whenever this artery suddenly gets blocked, either by clot or by spasm or by a dissection, you have a heart attack. The blood flow to the particular area of the heart is suddenly impeded, and this causes a cardiac heart attack. The second is cardiac arrest, when the heart suddenly stops pumping and the function of the heart stops. That's called as cardiac arrest. The third one which we are talking about is heart failure. Any of these conditions, or coronary artery condition, or myocardial conditions, or a congenital heart condition, which causes a lowering of pumping capacity of the heart. Your heart's not able to pump enough blood which is required for the body. This condition is called as heart failure. Cardiac arrest and heart attack, these are usually in emergency conditions, and immediate consultation is necessary. Whereas heart failure, it can be an either acute condition or it can be a chronic condition. An acute condition definitely requires immediate attention by a specialist.
Right. Dr. Medep, what steps should a bystander follow if he or she recognizes that someone is having a cardiac arrest?
Yeah, reacting to this situation is very important because it can actually save lives. So I think each and every individual should know the steps of CPR. So first step would be to assess for the safety of the unconscious patient and the bystander, look for the surroundings whether they are safe or not. Then followed by try to elicit a response. Just gently tap on the unresponsive person's shoulder and ask whether he is alright or not. If there is no response, check for the airway. try to open the airway, gently tilt the head and lift up the chin so that the airway gets opened. Then the next step would be to look, listen and feel for the breathing pattern. If the person is not breathing or if he is having shallow breathing, then it's considered to be abnormal. Then the bystander should be prepared to perform the CPR. The first thing is to call for help. If there is any other person in the surrounding areas, you can ask that person to call for help. If you are the only person, then you can call for help over the phone. Try and not to leave the unconscious patient unattended. So try to locate the nearest AED, that is the automated external defibrillator, which unfortunately in our country is still not very widely available. So then the next step would be to perform the actual CPR, which includes chest compression and giving rescue breathing. So for giving chest compression, the bystander needs to kneel down next to the unconscious patient, put the heel of one hand over the lower one-third of the breastbone, put the heel of the other hand over the heel of the first hand and start compressing. So the compression should be such that the chest gets depressed by about 5 centimeters and allow adequate recoil before compressing again. So these compressions should be done for about 100 to 120 times per minute.
Right.
Also the next step is to give a rescue breath, mouth-to-mouth breathing that we call, and this step needs to continue at a ratio of 30:2, 30 circulation, 30 compressions is to 2 breaths.
Thank you very much for that very clear explanation. We'll take a very quick break at this point, but when we come back, we'll talk about whether India has a clear law on CPR or not, and whether there are liabilities involved if you try and intervene. We'll be back in just a moment. Welcome back to Save a Life, an initiative to make people aware of the early signs and symptoms of cardiac arrest so that patients can get to hospital in time and that people be trained in resuscitation if the need arises for that. But of course, when it comes to discussing CPR, where exactly does the law stand? Dr. Jena, there's always a fear that if a person giving CPR is not well trained, he may cause serious damage to a patient. Does India have a clear law on this, and what is the liability of a rescuer when he's attempting resuscitation?
Yeah, regarding CPR, basically, if you are on trained, then the Indian Anesthesia Society, they tell that you can go for only chest compression CPR, means we have to compress the chest around 100 to 120 per minute of chest compression if you find somebody collapsing before you and you want to revive him. But if we go for the next step, that is suppose defibrillation, or we have to give shock to the heart, then that needs little bit of training. So I don't think there is any law per se to inhibit you to give CPR, because the Good Samaritan rule, they tell that it's a moral responsibility, and it's a responsibility that if somebody is collapsing in front of you, then we have to save the life. That time, that injury which will occur or something, there is no particular rule about that you should not go for that. I feel the law permits you to go for that. And if you are not doing that, if there is any liability, I suppose that there is nothing in that kind of law in India per se.
Right.
There are stricter rules in different parts of the world, but in India, I think it depends on the individual. But thing is that we should go for chest compression only CPR if you are finding somebody collapsing in front of you, and immediately you have to call for the help. That is the first thing. Till the trained person arrives, you have to go for CPR, that is chest compression only.
Okay. Dr. Deshmukh, what are the treatment options that are available for sudden cardiac arrest?
Whenever you find someone, whenever someone notices a patient having a sudden cardiac arrest, it can happen anywhere. It can happen in the mall, it can happen in a parking lot. The first thing you should do is immediately call for an expert help. You can call paramedic service, you can call 911 in other countries. And the first and the most important thing which should be done is CPR, that is cardiopulmonary resuscitation, should be started as soon as possible. Cardiopulmonary resuscitation is a life-saving measure. You are basically, improving the cerebral flow, the blood flow, and also trying to start the heart, also start the pumping of the heart. It's a very vital and important step. This cardiopulmonary resuscitation is usually done till your paramedics or the doctor or the expert team arrives. They usually analyze the rhythm by which the patient had a cardiac arrest. Mostly when if it's a arrhythmogenic condition, the patient is given defibrillation. So basically, you are filling that gap up. You're filling that gap up for the paramedics to come and take the patient to the hospital, where he can be started with advanced care, either in the form of intervention or in the form of surgical treatment or medications. So I personally feel that CPR should be given to everyone, either as basic life support or in the form of advanced life support. It should be taught to police personnel. It should be taught to security guards, and as my colleague and my friend had said, it should be made mandatory for everyone to learn it, because it basically saves life. And you're going to save precious moments where your cerebral circulation and your coronary circulation can also start at that time.
Right. Dr. Medep, what are the after effects of cardiac arrest, and what precautions should a person take after being discharged?
Yeah, the after effects after cardiac arrest are mainly neurological and psychological. So once the heart goes into a state of arrest, it obviously stops pumping blood. So the first organ to get affected in this scenario is brain. The brain is very sensitive organ. If the blood supply to the brain gets shut down for 7 minutes or more, the brain can actually go into a state of permanent damage, wherein the person can end up comatose. He might go into a state of coma, or he might develop some other neurological deficits. Unfortunately, these neurological deficits can be permanent. Even after the heart starts pumping again, the neurological status may not improve. The other aspect is psychological effects. The person who has survived a sudden cardiac arrest is almost always apprehensive as to when the next attack could come. So in this scenario, the person might feel very anxious. He might get depressed. He might develop something called as post-traumatic stress disorder. These are the two important aspects. And also, what precautions to take once the cause is identified and treated. The routine precautions like leading a healthy lifestyle, eating healthy diet. The important thing is physical exercise. One should not start strenuous physical exertion in the immediate post-discharge phase. So it should be in a graded manner. Enrolling oneself in a cardiac rehabilitation program will definitely help. Also, to reduce the stress levels in the form of yoga or meditation. To absolutely quit smoking, it's a very important step in prevention of another attack. And also to very diligently follow the medical advice, and medical follow-up is a very important step.
Right. Thanks very much indeed for that, Dr. Medep. Dr. Jena, what's the link between type 2 diabetes and heart disease?
Yeah, this is very important one, because now India is becoming the world capital of both diabetes and heart disease. Being Indians, we are prone for both type 2 diabetes and heart ailments. The link between these two is type 2 diabetes or hyperglycemia can cause atherosclerosis, means plaque or blockage formation in the coronary artery, leading to myocardial infarction or heart attack, as we commonly say. But the other things are, instead of these vascular things particularly, heart muscle can be directly involved with type 2 diabetes, causing cardiomyopathy, whether it's a pumping dysfunction or it's a receiving dysfunction, that is technically known as heart failure with preserved ejection fraction or heart failure with reduced ejection fraction. So cardiomyopathy is possible. One of the most neglected or underdiagnosed thing in type 2 diabetes and cardiac thing is cardiac autonomic dysfunction, or CAN. What happens with autonomic dysfunction due to diabetes? The chance of sudden cardiac death is multifold, particularly in diabetic. So all sudden cardiac death in diabetes may not be due to heart attack itself. It may be due to autonomic dysfunction also. So in this three way, means by a vascular pathway or directly involving the muscles or involving the nerves, it can affect the heart health.
Right. All right. Thanks very much indeed, all of you, for joining us on this discussion. Thank you for watching Health and Wellness Save a Life.